dopamine deficiency and its possible relationship to BPD. And this can be a really important video because I think that a lot of individuals with BPD are always trying to build a sense of insight and understanding into what could be causing that BPD, what could be causing some of those issues that cause impulsivity, poor ability to control your behavior, memory impairment, and other issues as well. So hang on tight. We're going to get into it. BPD, dopamine deficiency, and like, share, and subscribe. Comment too, and here we go. Dopamine. Now, low levels of dopamine, they have been found to be associated with Parkinson's disease, restless leg syndrome, and even depression. Also, BPD, which we're going to talk about in a second, those BPD symptoms, which we're going to talk about in a second, but I want to frame it so you understand what dopamine deficiency is. Now, low levels of dopamine can make you feel tired, moody, unmotivated, and a whole host of other stuff that we're going to talk about. Now, treatments are available for many of the medical conditions that are linked to low dopamine levels. Dopamine, it's this neurotransmitter and a hormone. It communicates these messages, right, in your brain between nerve cells and your brain, or between your brain and the rest of your body. Plays a critical role in many of your body functions, including memory, motivation, learning, reward, and movement. BPD. Anybody? I'm not saying that there's a direct relationship or anything like that. I'm just saying that we notice this influence of dopamine on these particular areas. Okay, now dopamine deficiency. What this means is that you're having a low level of dopamine. Low dopamine, right, are linked to certain health conditions, Parkinson's disease, or depression. It can also make you more susceptible to taking risks or developing addictions. Now, what can cause low dopamine levels? It could be an injury, traumatic brain injury. Could also be that your body doesn't properly respond to dopamine. So if there's a problem with nerve cell receptors that pick up and pass along those chemical messages, that you could have an impairment in that regard. Certain health conditions have been linked to dopamine deficiency, like I mentioned. Parkinson's disease, depression. Also, it's been found that people with cocaine addiction need more and more of the drug to achieve the positive effects because of damaged dopamine receptors in their brain and decreased dopamine release. So what are the symptoms of dopamine deficiency? First, you lack motivation. You lack that drive, right? You're tired. You can't concentrate. You're moody and anxious. You don't feel pleasure from previously enjoyable experiences. It can also be called anhedonia. Also, you feel depressed, you feel hopeless, you have low sex drive, and you have trouble sleeping or have disturbed sleep. Now, these could all be dopamine deficiencies, right? All of these symptoms are related to dopamine deficiency. Also, what I want to mention here too is that our phones are a source of dopamine hits. A lot of our behaviors are a source of dopamine hits. What happens is that as we're constantly engaging with these phones to get the dopamine hits, right? Because we're scrolling and we're looking at stuff and it's like pow, 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 pow. And what happens is over time is that your brain tries to keep up and it can't. And then we start to have these symptoms, that lack of drive, feeling very tired, fatigued, can't concentrate, anxious, that anhedonia that I mentioned and things like that. It could be because of cell phone overuse as well. You're consuming too much. You're looking for all those dopamine hits. That can be an issue as well. Now, other symptoms of low dopamine levels, that includes like hand tremors or other tremors, such as loss of balance, coordination, increased muscle or limb stiffness, muscle cramps, that restless leg syndrome, which I talked about, problems with short-term memory, managing daily tasks and solving simple problems. That can be symptoms of cognitive changes sometimes too. It's problems with anger, low self-esteem, anxiety, forgetfulness, impulsiveness, and lack of organizational skills. These are symptoms that can also be associated with ADHD, so we need to bear that in mind as well. Now, social withdrawal, reduced emotions, don't feel pleasure, and just like we mentioned, that anhedonia. Gastrointestinal symptoms, such as like chronic constipation, things like that, also can be associated with low dopamine levels. Now, all of these symptoms, right, there are many symptoms associated with dopamine deficiency. Now, what you might experience depends upon what's driving it, right? What is that underlying cause? So symptoms could be quite different for low dopamine levels that's associated with someone with Parkinson's disease as associated with somebody with schizophrenia or BPD or ADHD. Now, how do you diagnose deficiencies in dopamine? Well, it isn't a medical diagnosis. Healthcare providers can rarely check dopamine levels. Now, a blood test, that can provide some information, but not a whole lot, because it can't determine how your brain responds to dopamine. So your healthcare provider, your medical provider can gather your medical history, ask those lifestyle questions such as alcohol, drug use, responses to stress, lifestyle functioning, those types of issues, just as I mentioned, lifestyle questions. Ask about your symptoms, examine you, and order those needed tests based upon those symptoms. And the information and the findings from those tests, your healthcare provider will determine if you have a medical condition to a low dopamine level. Now, it's not necessarily a guess, but what we're doing is they're trying to gather data so that they can say, okay, that this is pointing in the direction of dopamine deficiency, and perhaps they could prescribe something like Wellbutrin or other types of medication that can help to increase those dopamine levels in the synapse. So let me just answer real quick before we do a deeper dive into the BPD dopamine factors, but let's talk about depression and ADHD. So how are these treated? So treatment of depression may include SSRIs like Prozac, fluoxetine, that affect both the neurotransmitter serotonin and dopamine to make them work more efficiently. So also for ADHD, this condition can be treated with Concerta, Ritalin. There's medications which can increase dopamine activity, and those have been found to be efficacious and helpful. Now, does that mean that if you take these medications, suddenly you're not going to have BPD symptoms or depressive symptoms or anything like that? No. And I think I'm going to talk about this here, and I'll probably address it later too, but because taking the medication doesn't teach you how to manage situations. It only adjusts how you feel about the situation. And that's two very, very different things. Because how you feel about a situation, maybe you're at a higher likelihood to not react as intensely. That's great. But how can you make that choice to behave more efficiently, to manage your behavior? Because life is based on probabilities. Engage in positive behavior increases the probability of positive outcome. Negative behavior increases the probability of negative outcome. So what's important is learning those skills to navigate those interpersonal interactions, intrapersonal interactions, thoughts, feelings, and drives, those internal drives, right, that you may have as well. It's managing those things. How do we do that? And I think that's where therapy, workbooks, learning about yourself, YouTube videos, also helpful, can be good for you as well. It's building that insight, building that understanding. Taking medication doesn't give that. It may change how you feel, which I think is good if it's preventing you from self-harm. It's preventing you from being violent, whether towards yourself or others. If it's preventing you from becoming overwhelmed, so then you engage in maladaptive beliefs, behaviors, and patterns, then I think that's fantastic. But that learning has to occur with it as well. Now, can you increase your dopamine in a natural way? Now, there's some studies that show that if you eat a diet high in magnesium and tyrosine-rich foods, these are the building blocks of dopamine production. Tyrosine is an amino acid. It's absorbed in your body and goes to your brain where it's converted into dopamine. Foods known to increase dopamine include, here we go, chicken, almonds, apples, avocados, bananas, beets, chocolate. I love chocolate. Green leafy vegetables, green tea, lima beans, oatmeal, oranges, peas, sesame and pumpkin seeds, tomatoes, turmeric, watermelon, and wheat germ. Now, you can also engage in activities that make you happy and feel relaxed. This is thought to increase dopamine levels. For example, exercise, meditation, yoga, massage, playing with a pet, walking in nature, or reading a book. These are natural ways to increase those dopamine levels. Now, I also want to throw out that low dopamine levels that we don't want to split on that, right? We don't want to get engaged in that black and white thinking, okay? Because it's a very complex issue, right? Just as we mentioned, for your medical provider, it's hard. They can't say, yep, you have dopamine at this level. Yep, it's low, or it's this level. Yes, it's low at this level, high at this level, whatever it may be. So it's important to know that low dopamine levels don't necessarily cause all of medical conditions. Now, there's a link or an association, but low levels don't directly cause that medical condition. Remember, low dopamine levels are linked with, just as I mentioned, restless leg, Parkinson's, but also obesity as well. And it's known that the food you eat and exercise can affect how your brain uses dopamine. Exercise is so important, and I know it's hard for some folks and things like that, but it doesn't have to be intensive. You don't got to be in the gym dripping with sweat and all that other stuff. Even taking a walk for 15 minutes every day is great. And if you like to walk and you have a pet, a dog, I mean, some people walk cats, but whatever you want to do, get out 15 minutes, walk with a pet. Getting out, some exercise. Doesn't have to be intensive to get a little dopamine boost. Now, poor food choices. Now, these are foods that don't boost dopamine levels and lack motivation to exercise. That can contribute to low dopamine levels, just as I mentioned, so that you don't get that reward system trigger that we're looking for. So be careful of how much junk food you eat. And I know junk food is good. I like junk food. I think I'm going to have a burger later. It's not going to be good for me, but I think I'm going to have a burger later. That's what I'm going to do. Hey, so remember that no neurotransmitter just works on its own. It doesn't work in isolation. And dopamine works closely with serotonin, right? They're buddies. So understand that the neurotransmitters that we're talking about, it's a complex subject. And I know that it can be very confusing. So when we talk about that, let's kind of slide into BPD. And let's talk about dopamine and what we know about the association with BPD. Some researchers have identified or believe that dopamine dysfunction or deficiency may be involved in the development of BPD. This mainly stems from studies that support dopamine role in thinking, regulating emotions, impulse control, and those are certainly factors that individuals with BPD are contending with. Now, current research studies are evaluating the link between chemical imbalances of serotonin, dopamine, and norepinephrine. And we're hoping, or what we hope will result, is to better identify how these are driving BPD symptoms. Now, initial findings reveal that dopamine deficiency can accentuate BPD clinical features. So you're not going to take Wellbutrin and all of a sudden the BPD beliefs, behaviors, and patterns magically fly away in the air, right? Like dust just being pushed down the road that magically it's gone. It doesn't happen. It's about building insight. It's about building understanding and pushing back. But can it provide an assistance to address some of those issues, to attenuate some of those adverse maladaptive patterns, behavioral patterns? Absolutely. Some of those maladaptive beliefs? Absolutely. So I think that if it can, then it could be of benefit. And what happens is because, and I've seen this in my clients, what happens is that over time, as you build those skills and you build natural ways of managing your dopamine levels, that the requirement for medication decreases. I've worked with individuals that have been on high doses of antipsychotics, and it was more for behavioral control than it was for psychosis. So as we're working together, as years go by, that they build those adaptive strategies and they become habits. Those adaptive strategies become habitual. So they encounter some stress and their reaction is adaptive, which we know increases positive outcomes. So hopefully we develop this positive feedback cycle. And once they're in that positive feedback cycle loop, then they reinforce themselves. And now you're engaging in more of those behaviors. Then we can start to lessen some of that dosage. And we do this working very closely with their psychiatrists, whatever it may be. It's been really, really beneficial for a lot of folks. So it's possible to do this. Is it easy? No. Is it possible? Absolutely. So I hope that you found this helpful. I thought it was some good information. Leave some comments, just some thoughts that you may have or questions that you may have as well. And I appreciate it. And I'll see you next time. Like, share, and subscribe. And I'll see you next time. Thanks. Bye-bye.